Hi, I'm Jen, Bariatric Surgery Coordinator with Willis Knighton Health. This seminar is going to give you an idea of what to expect from our program. Let's take a look. Welcome. We're glad you're here. We're excited to get started on your journey to better health. Our program is accredited through the American College of Surgeons and their Quality Improvement Program. This is Dr. Brockta. He's our surgeon. He's board certified in general surgery, specially trained in metabolic and bariatric surgery, and he is an SRC accredited master robotic surgeon, completing over 2,500 surgeries robotically. He's also the medical director for our bariatric surgery program here at Willis Knighton. This is Sabrina and Nicole, our PAs. They kind of drive the train for the program here, and you'll meet with one of them at each visit. Candy is our behavioral counselor and Sharon is our dietitian, and you'll meet with each of them at each visit as well. Here is our weight loss surgery booklet, and if you look with me here on page 4 is your pathway to surgery. These are the things we're going to need to get done prior to getting to surgery. Today marks as your seminar. You'll attend a consultation in person and meet with all 3 providers. We typically see you on a monthly basis for 3 to 6 months to go over education, behavior changes, dietary requirements, and give you all the tools you need to be successful with your weight loss. We require a psychological evaluation with a licensed prescribing and diagnosing provider. We also want you to get an exercise evaluation at our fitness center, as well as attend our support group, which is held monthly, either online or in person here at our office. Once you've completed all of those steps and you've been approved for surgery, you'll attend our surgery workshop. Then you'll go to surgery about 4 weeks later. After surgery, we follow up with you at regular increments, 2 weeks, 1 month, 3, 6, and 12 months, and yearly for as long as you need us. We monitor for vitamin deficiencies and make sure you stay on track to reach your health goals. We offer 2 procedures here. The first being a sleeve gastrectomy, or sometimes called a vertical gastric sleeve. The way this procedure works is the surgeon goes in and staples off approximately 2/3 of the stomach, removing that portion from you completely. You're left with a small tube about the size of a highlighter that can hold 1 to 2 ounces of food or fluid at a time. This is a great surgery to help you achieve initial weight loss, usually around 50 to 60% of your excess body weight. The only downside is it can increase acid reflux if you already suffer from that. The other surgery we offer is a gastric bypass. This surgery is a little different, where the surgeon goes in and staples off the upper portion of the stomach, creating a pouch about the size of a large egg. He then attaches the small intestine to the lower portion of that pouch, therefore bypassing part of the stomach and small intestine. This surgery works by reducing how much food you can eat at one time and also limiting how many calories and nutrients can be absorbed. With this surgery, we see about 60 to 70% weight loss of excess body weight. This surgery also effectively reduces acid reflux, as food, fluid, and acid can move more freely, bypassing the pyloric valve. This surgery is also done robotically and requires a 1-night stay. Both surgeries require lifetime vitamin therapy and diet and lifestyle changes. Do you qualify? You wouldn't be here if you didn't preliminarily qualify, but BMI of 40 or greater or 35 or greater with a comorbid condition is typically required by insurance. We'll verify each individual insurance to make sure that you do qualify. We also want to ensure that you have family or social support to help you along the way. This is a tough journey, and if you have family members, church members, coworkers telling you you don't need to do this, or they know something about surgery and something that happened to someone they love, let us know about that so we can help you navigate those conversations. We also want to make sure you're prepared to make a lifelong change in your relationship with food. Limiting factors. If you're under 18, history of a psychiatric illness not stabilized on medications for at least a year, the use of drugs including marijuana or alcohol, the use of nicotine in any form, cigarettes, vape, tobacco dipping, patches, or gum. If you are using at this time, we'll give you time to quit, but nicotine is a no for lifetime. The ability or desire to become pregnant in the next 2 years, or the inability to commit to lifelong change or attend appointments. If you regularly reschedule, we're not able to build on that foundation of knowledge that you'll need to be successful with significant weight loss. And if you no-show to appointments, unfortunately, we won't be able to offer you a surgery. We do also nicotine and drug tests throughout our program. Okay, let's get started. On page 9 of the seminar booklet are some behavior changes we want you to get started on. We like for you to pick 2 or 3 things. If you do too many at one time, you may get overwhelmed. If you're a sweet drinker, sweet tea, Cokes, Frappuccinos, you may change those out for water or low-calorie, no-sugar beverages. If you're a fast food eater, you may reduce fast food to 1 time per week. Our program is based on the building blocks. We call those the bariatric building blocks, and there are 4 of them. The first is nutrition, and nutrition is meant to fuel your body. Before surgery, nutrition is important to help you get into optimal health, reduce the size of your liver, which makes surgery safer, and adjust your body to new eating habits. We really want to change the way you think about food, and we're going to discuss the different diet phases of bariatric surgery. A 3-day liquid diet challenge, how to keep a food journal, how to read food labels, healthy swaps and quick tips, and sample meal plans to aid you in your weight loss journey. The second building block is exercise. And exercise is important not just for weight loss, but for recovery after surgery. If you can have an established exercise regimen, this will make exercising easier after surgery as well. It can start out as simply as walking for a dedicated amount of time a day, working out in the gym, pool, lifting weights, or attending fitness classes. We want you to find something you love. You can also get an exercise evaluation with our exercise specialist, Curry, over at the fitness center. And Willis Knighton Fitness Center also offers a bariatric gym membership discount to our patients specifically. We can talk more about that later. What counts as exercise? We want your heart rate up, breathing hard, and sweating. This is going to increase your cardiovascular health, which makes surgery safer. At the end of the day, we want you moving more. If you're doing nothing now, give us 10 minutes a day of a brisk walk, up to 12, 15, and 30 minutes 5 times a week. The third building block is the brain, or behavior modification. Our program includes counseling with a licensed social worker who's going to help you identify changes you can make around food and eating in your everyday life, as well as navigating when life happens. Birthdays, holidays, vacations, funerals, all of these things still happen after surgery, and we have to learn to navigate around that. We're going to discuss self-care, personal hygiene, checking in with ourselves mentally, and mindful eating. Why are we eating the things we're eating? Is it emotional? Are we in a hurry? Is it convenience? All of these things our counselor are going to cover with you. We also require a true psychological screening, and we have resources to refer you to. The fourth building block is surgery. How does surgery work? Surgery works by metabolic changes. It reduces ghrelin, the hunger hormone that tells our brain we're hungry, even when we may not be. It also increases GLP-1, the satiety hormone or fullness that tells us we're full. It restricts how much food you can intake. It can limit nutrients being absorbed and calories. It's also done robotically, making it minimally invasive. A one-night stay, 4 to 5 small incisions, you're up walking the day of surgery, and you go home the next afternoon. And lastly, our patient commitment. Our patient commitment is on page 21 and 22 of the seminar booklet. These principles are some we want you to commit to us, but we really want you to commit them to yourselves. This is what's going to help you have long-term, significant, successful weight loss. Adopting a healthy relationship with food, participating in physical exercise, following all of our pre-surgery and post-surgery guidelines, mental and emotional health, making sure you're doing the work in the program and outside of the program, and lifelong commitment. Surgery is a tool. It's not a cure, it's not a quick fix, and it's not the easy way out. It will require lifelong effort and dedication. We want to make sure you're committed to making these changes, not just before surgery, but for the rest of your life. Also, understand the success of this program depends on your active participation and accountability. I'm here as a motivation to you to help push you through. I know what this is like. I know what it's like to struggle with obesity. I had weight loss surgery in 2022 with Dr. Brocta. I know that it's not easy, but I also know the successes that are available with significant weight loss. I'm here to help you through this program, and I'm excited for you to get started.